Hello, my name is Manpreet Sidhu and I'm a consultant orthopaedic surgeon specialising in knee surgery. Your recovery from knee replacement surgery can take several months or longer. This can depend on your age and health. But to ensure a good recovery, it's important you follow the advice the hospital gives you on looking after your knee. You can start preparing for your recovery before your operation by eating a healthy diet, managing your weight, exercising and stopping smoking if you smoke. Also, making sure things you use often are easy to reach and stocking up your freezer with cooked meals can make life easier for you when you return home from hospital. When recovering from a knee replacement, you should use crutches or walking sticks at first, going down to one crutch or one walking stick when you feel confident. Get up and walk around for 5 minutes every hour to help prevent blood clots. Keep your leg raised as much as possible to reduce swelling. And make sure you follow the exercises your physiotherapist has recommended. Also, try to avoid twisting your knee, bending down, or reaching up. Here are some things that you shouldn't do when recovering from a knee replacement. Do not sit with your legs crossed during the first 6 weeks. Do not sleep with a pillow under your new knee. Do not kneel on your new knee until your doctor says you can. Do not stand for long periods of time. Do not lift or move anything heavy for the first 3 months. And do not drive until your doctor has advised it's safe to do so. You should check with your motor insurance company too. Before you leave hospital, you'll be advised what painkillers or other medicines you can take at home. Taking painkillers before you do your physiotherapy exercises can make them easier to do. You can also try ice packs to help reduce any swelling. A nurse will take out your stitches or clips after about 10 days. You'll also have a follow-up appointment about 6 weeks after your operation to check that you're recovering well. You should ask for an urgent GP appointment or get help from NHS 111 if you've recently had a knee replacement and you have throbbing or cramping pain in your leg, a high temperature, chills and you feel shivery, oozing or pus coming from your wound, redness, tenderness, swelling or pain in your knee that's not getting better or is getting worse. These could be signs of an infection or a blood clot. You should call 999 or go to A&E immediately if you have pain and swelling in your leg and you're having difficulty breathing or you have chest pains. This could be a blood clot in your lung, known as a pulmonary embolism. This needs to be treated immediately. To find out more about knee replacements, follow the link to the NHS website.